Dr. Payne here with Rejuvenate Health and Wellness Centers. I wanted to come on here for a minute and just talk to you guys real quick and ask you a couple of questions and let you know that we here at Rejuvenate Health um, are thinking about you as you go through this time of maybe not having power, maybe not having water or food or even shelter. And we want to extend our sympathy to you guys. Things like that, it just puts a lot of physical stress on you, a lot of emotional stress, a lot of financial stress, if I can talk today. Um, and I want to kind of tie that into um, what my mission is, and that is to always talk about health. Even as you go through this time, I don't want you to forget about taking care of yourself. Sometimes we have these physical and emotional stressors, and they hit us all day. Have you ever eaten anything and felt sick, just totally sick, or bloated from it, or disgusted? And it looks good on the plate, but as it went down and got there, it's not sitting well. That's an example of a chemical stress. So we have physical, chemical, and emotional stress. And when those stressors are greater than your body's ability to adapt, it can cause havoc, like creating what's called subluxations in your nervous system. Subluxations are kind of like if I talk to you with my hand over my mouth, you're unable to understand it. Your nervous system is unable to communicate to the rest of your body, and your body can't communicate to your nervous system. And that results in pain, disease, inflammation. And so, with those three types of stressors on your body, what sometimes happens is as we go through life, and we have these physical, chemical, and emotional stressors. We kind of go through life and our body tries to adapt to it. But if we don't give enough energy back to our nervous system, we don't take care of ourselves, we don't give enough energy back to our spine, then as we're going through life, we'll fall off the edge. Okay. And the reason you're doing that is because you're unable to your body's unable to neutralize the amount of stress that's being put on it, and then you get different types of symptoms. So it's imperative to determine what you want to be. Okay. How do you want your body to handle these things? So sometimes some people go through life, they fall off and they get back up, and they fall off and they get back up, and they do that with their health. And that type of falling and get back up when it comes to your health is acute care. You're only treating what you're feeling, and you're only getting treatment when you're in pain. Then there are some people who have a small buffer against that stress. And they've gotten to a point where they have stabilized their health, they've stabilized their subluxations, especially when it comes to chiropractic. And they're able to kind of have a little buffer when it comes to improved health. And then there are those type of people that go through life and they go through the stressors, and they've gotten to the point where they have stabilized their health. But the good thing is that these people, when they fall, they can bounce right back up. And the reason they can is because they're on wellness care, they're on maintenance care. And wellness care gives you a larger buffer against these stressors that hit you from all over, from every side, all day long, nonstop. So I want you to ask yourself, what serves your life better when you are confronted with these stressors? Do you want to be the type of person that gets up and down, up and down, up and down, and hope to make it through? Or do you want to have a little buffer and you're able to maybe enjoy some of the improvements in your health because you can kind of sort of adapt to some of these stressors? Or do you want to be the type of person that has a large buffer to where when it gets to the edge, they're way over here versus being so close to the edge? And even those people on wellness are able to drop off that edge if that so happens, but they can recover and bounce right back. So I wanted to bring that to you and ask you, what are your thoughts? What kind of stressors do you have in your life? You can comment below. And I want to have you think about, when it comes to these stressors, which one of those do you prefer to be? You guys have a great day.